How does internalized drive TB stigma affect patients? Imagine feeling trapped by your own thoughts, convinced that you are somehow less worthy because of your illness. That's what internalized drug-resistant tuberculosis stigma can do. When patients absorb society's negative attitudes about tuberculosis, it can deeply affect their mental health, social life, and ability to stick with treatment. This stigma often leads to feelings of shame and low self-esteem, making patients believe they are to blame or unworthy. Such feelings can cause emotional distress, including depression and anxiety, which may become so severe that they even think about harming themselves. When mental health suffers, it becomes harder to stay motivated to follow through with complex treatment plans that last many months. Missing doses or stopping treatment altogether can happen, which worsens health outcomes and increases the risk of spreading resistant strains. Stigma also pushes many patients into social isolation. To avoid judgment or discrimination, they might withdraw from friends, family, and their community. Even if they are no longer contagious, fear of rejection keeps them from seeking support or participating in social activities. This loneliness can make emotional struggles worse, creating a cycle of despair. The social withdrawal can also impact their work or education, leading to job loss or missed opportunities, which can cause financial hardship. Women with drug-resistant tuberculosis often face even more stigma because of cultural expectations and gender roles, adding to their emotional burden. In some cultures, protecting family reputation is so important that patients hide their illness, which delays diagnosis and treatment. Fear of stigma is a major barrier to early diagnosis and care. Patients might avoid going to clinics or delay seeking help because they worry about being judged or ostracized. This can lead to disease progression and increased transmission within communities. Healthcare providers play a key role here. When they provide clear, consistent information about infection control and treatment, it can help reduce fears and misconceptions. Interventions like mental health support, peer groups, and community education are vital. These programs help patients feel understood, supported, and less alone in their journey. When stigma is addressed, patients are more likely to stay on their treatment, recover better, and regain their confidence and social connections. Overall, tackling internalized drive TB stigma is essential for improving both health outcomes and quality of life. If you or someone you know is dealing with this, it's important to seek help from healthcare professionals who can provide personalized support and guidance.